Here we have the clinical procedure for measuring a patient's temperature. We see that we have a household thermometer here, but before we begin, we first must be certain that our hands are clean, there's proper hand hygiene, and we are wearing our gloves. Because this procedure does deal with oral, we want to be sure that we are protected and not contaminated in any form. So as we proceed, first we want to, I'd like to introduce you to Mr. Frog. This one is a typical household thermometer, digital thermometer used for the younger patients. However, we welcome Mr. Frog in helping us today. So as we take a look, we have the thermometer. We see the plastic covering on top of it. Now in a doctor's office thermometer, we also have that plastic covering. But the difference with this thermometer is that we don't have another covering on top of here. If this was in a walk-in or a doctor's office, there would also be a plastic covering, which is referred to as the probe cover. This probe cover is situated on top here until about up to here, and it is disposable. So after every patient, that probe cover is disposed into the biohazard waste. So in order to take a temperature of a patient, we need to first make sure that the probe cover is there. It has been sterilized either in a solution that is in the doctor's office or through an alcohol wipe. And we keep that probe cover on and insert it into the patient's mouth. Now it is important to remember to always speak to the patient, ask for consent. May I insert this into your mouth, and wait for the beep. And give them instructions that this is supposed to be located under their tongue, and just give them a summary of points so that they can follow your instructions. So first we need to turn on the thermometer, and I will demonstrate on myself. So as we proceed, we will take the thermometer and ask the patient that to be inserted into their mouth underneath the tongue. Now that we have heard the beep, we remove the thermometer and we see that I am exactly 37 degrees Celsius. So we now need to sanitize. We take note of that 37 degrees. Now we need to sanitize the, we need to first discard the probe cover. We take that off and throw it into the biohazard waste, and then we sanitize the remainder of the thermometer using the alcohol wipes. Now that we have sanitized, we will insert the thermometer back into its cover, and we will remove our gloves in the correct fashion, and we will of course be noting three things: the temperature of the patient, the date it was taken, as well as who took the temperature. So I would be putting my own initials. And that is the end of measuring a patient's temperature.